Hello, I'm Farah Nasralli. I'm a longtime dedicated yoga student, longtime teacher, and I'm particularly interested in having conversations around how yogic tools and practices can be applied during times of intense stress. And over the last 2 years, we've definitely been in a time of intense stress. And I'm really excited to be in conversation with a dear friend, Corrine Mckell. Do you want to say a few words about yourself?
Sure. Thanks very much, Farah, for having me. My name is Corrine Mckell, and I am, as well, a longtime yoga student, a yoga instructor. I also work as a frontline nurse and as a nurse educator. And I'm really interested to talk with Farah about how the skills of my yoga practice has really helped support me as a nurse, and my passion to share these skills with my community and in the healthcare professionals I work with. And honestly, Farah, what a couple of the experiences that just really affirm how important self-care is again, sometimes the reasons why I think a lot of us don't make the time is because we feel like that gets sacrificed for others. But like I said, not only am I then more present with the other people in my life, there's just more space, right, for more other fulfilling experiences in life than there is when I'm not practicing and checking in and slowing down.
Yeah, I think for a lot of people, you really have to experience the power of a practice to really understand its value and how it really fundamentally shifts so many parts of our life. And sometimes, crisis leads to that. Um, sometimes it takes a lot of momentum to bring us to the place where we must make a commitment to it,
Yeah.
you
Yeah.
know, which for me also indicates that sometimes our moments of breakdown can actually lead to very profound gifts and lead to things that really can become cornerstones of our resilience.
And another moment that it kind of like this huge moment when I realized how important this is for me was when I started in my position as a nursing instructor. So at my workplace, I'm a clinical nurse educator. So when new staff get hired on, and I work in an addiction recovery center. So I'm teaching all about caring for patients, right, who are in substance withdrawal, and then and nursing skills. And as I'm really trying to do a really good job at describing the challenges our clients go through and a lot of the shared experiences they have, which are very much at the foundation of all is traumatic experiences that they've had, right, that are often always associated with addiction. And that's when I had this moment, right, when I'm sharing these experiences and stories of people that we take care of, and realizing that, I'm expecting staff to hold space and be present to all of this trauma. And what am I offering them for skills to support themselves? Yeah, and we don't, that's not part of our formal education as nurses. And again, it was just this like, what am I doing?
This just you recognized a gap.
Yes.
In nursing education and not being able to give them the resources to actually fulfill the emotional part of caring.
Yeah, absolutely. So that was what really kind of spearheaded my passion for this conversation, right? And in the workplace and personally and amongst my working friends, it just was so, I just can't, it was just like this, like, I can't believe this. Like I've been nursing 17 years and I just put this connection together. Like, what? You know, it's not okay. And things are shifting and we are trying to have these conversations and talking about practices to support the hard work that we're doing.
Practices to really support the emotional resiliency of people in the caregiving professions and health professions.
Yeah. And at the end of the day, again, when I don't know why we do this. I think a lot of us do. It's our human nature to put our needs aside in front of other people's. And the research shows and the practice shows that when we're caring for ourselves, that we're better caregivers. Not that not ourselves should be enough, and I know that. But it's a good reminder when it's hard to, again, make that time, right, to take care of other people. We just do a better job when we take care of ourselves.
So interesting sometimes that sometimes when research or science validates something, it makes it more credible, even though as if it isn't credible on its own. To know that we should take care of ourselves.
Yes. Well, and that's the examples too with meditation, right? I think now that's why it is getting so much attention. It has been used already for tens of thousands of years, but especially here in the West, we really like science. And the evidence is in, right? Like the MRIs, the CAT scans, like there's numerous systematic, peer-reviewed, so many articles and journals that prove the health benefits of meditation. And we relate to that, right? So now I think there is an openness. Like you can't, the positive results are so profound.
Definitely. For me, the proof is in the people who practice that I've met who have a quality that has always drawn me and provoked my own curiosity and interest. So, when you have examples, when you see real life examples of people who have a certain quality and then it inspires your own interest. And I certainly hope that you're providing that example for others in the nursing field.
Yeah, I'm certainly trying my best.
It's been really wonderful to be in conversation with you and have this kind of dialogue about the importance of mental health and well-being and the kind of tools that yoga and meditation can offer for all people, but especially those involved in health and service and caregiving roles.
Well, thanks so much for having me, Farah. It was really nice to talk with you.